For my video teach back, I'm doing childbearing and post care. So for labor, the most important is preparation and relaxation. There's different choices one can make to have a home birth or a hospital birth. Some prefer having midwife, doula, and comfort at home, it's becoming very common for low-risk pregnancy. But some people prefer to have doctor care. If birth is extremely painful, medication may be necessary. Precautions could include a C-section, which is to dissect the stomach if there's a feeling that the baby is not coming out and there's difficulty with that. So moving on to the different labor stages. There's false labor, which is a feeling that there's really a labor going on, but it's just contractions. A few weeks in advance they begin. Real labor, there are signs of blood and baby moving downwards. There's different stages of labor. So the first stage is latent stage. This is contractions are coordinated and cervix dilates to about 4 centimeters. The pain is similar to menstrual pain and usually lasts for 8 to 12 hours. Contractions go to about 10 minutes apart. It's important to stay hydrated in this stage, and chamomile tea can be taken to relax nerves. Raspberry leaf tea can be taken to stimulate contractions, 1 cup per hour. For pain, valerian tincture can be taken 2 to 5 milliliters hourly, maximum 10 doses, and massaging breasts help if contractions are not starting. The second stage is the active stage. So this is active contractions, cervix dilates, and the woman feels the pushing down of the baby. Breathing techniques are very important. It's better not to push and to have natural contractions, as it may result in ripping. Many women report altered consciousness during this state. In full dilation to delivery is usually about 2 hours long, and the women push when they are ready. So the first contraction pushes the head through, and the second contraction pushes shoulders through. To prevent tearing, olive oil can be applied when the baby shows its head. After baby is born, this is the third stage, uterus contracts, separating the placenta from the wall. This usually takes about 20 to 45 minutes. So the second part is postpartum care, which is very important. And it's called puerperium period, and this period belongs to the child. It's usually lying in 6 to 8 weeks. While reproductive organs shrink, the uterus shrinks 100 to 60 grams in size. There's a discharge called lochia occurring. It's bloody red and turns white, yellowish mucus. It lasts about 3 to 4 weeks. So, healing and recovery. Lavender and chamomile compress can be made for tearing, 30 grams total, and simmer in boiling water and add to the bath. This can help for healing any tears. Another thing that can occur is postpartum depression. It affects 70 to 80% women. It's just the hormones are adjusting to normal. There may be frequent crying and changing of moods. Different things that could help is aromatherapy, jasmine, ylang ylang, and clary sage. Also, herbs like borage are specifically good for postnatal depression. So lastly, we have baby and breastfeeding. This is important for health and bonding of the baby. Different herbs and different things will help in order to produce milk. So galactagogues include fennel, fenugreek to help milk flow, as well as oats. Verbena and oats will help increase milk production if there is anxiety and the person is tense and not able to produce milk.